Step number two is learn about your pain. And this might seem like a weird step to take for some people, but it's actually a really, really critical step. And a lot of people would think, I know all there is to know about my back pain. I've had it. I've been living with it for a long, long time. There's not much you can tell me about it. The fact of the matter is, if you understand the biology of the pain, it can make an enormous difference. So not just talking about understanding from the point of view of, yeah, I'm familiar with it, but understanding how it actually works, the nitty gritty. It doesn't necessarily need to be at a university level of knowledge either, but a workable, a practical amount of knowledge to understand what pain actually is there for and when it's important. And if even understanding something very simple like that, understanding when it's okay to work with it can make an enormous difference to how you approach your back pain. And as David Butler, the internationally renowned pain educationalist, physio, keynote speaker, said, understand why you hurt and you will hurt less. And that's been shown as well in studies that people that understand what's going on have less pain. And I can't say that as soon as you start talking with people about the biology of pain that all of a sudden their pain levels drop down. But what it does do is it allows people to understand why it is okay to move, sometimes when it hurts. It is important that if you're going to do something that hurts, it's really important to understand why and why it isn't harmful, why it's okay. Because if you're just doing an exercise because you're told to do it, but it hurts, it's really hard, that's counterintuitive. To do something, you're told to do something and you just do it, but it hurts. It's much better to be doing an exercise that someone has suggested that you do with the knowledge that, yeah, it might hurt, but this is why, and it's actually okay, and that there's some thought behind it, and there will be a result at the end of it. And also knowing about the parameters, how much pain is okay to have, and how long is it okay for pain to last after doing something, and how much of an increase in pain is okay, or how much of an increase is counterproductive. What does a flare-up mean? What does it actually mean inside my body? Why flare-ups? Something that they happen. There's something not to be scared of though, but they're kind of something to avoid as much as you can. So these are the things that understanding pain will help with, and a little bit like with the red flag discussion, how once you get all those nasty conditions ruled out, once you've had the red flags assessed, you've got the green light to move. I think once you have a working understanding of pain, you understand it better, you understand why things can still hurt even though there's been adequate healing time. Once you understand that, that also gives you a green light as well. You're getting permission to move. So an understanding of pain, I would argue, is pretty important. And as time goes on, so if you have an acute injury, the pain that you experience at the time, let's say, for example, you sprain your ankle, the pain you have at the time is useful. It serves a really important purpose, that it's telling you to stop, do something, take action, don't damage it further. What happens as time goes on is the pain you experience is less to do with something that's happened in your body, when I say your body, in your ankle, for example, in this case. It's less to do with what's going on in the ankle, and it's more to do with what's going on within your central nervous system, brain, spinal cord, nerves as well. And it's less representative of what's happening in the tissues. And even just understanding that idea that, I know my back hurts and it really hurts today and it's not a good day and I feel like I can't move, but it's not because you've actually done something new or that you've irritated the tissues, that there are other factors that are bigger players if you're talking about persistent pain. So understanding pain, step number 2, Doesn't need to be to any kind of university level of understanding of pain science, but it certainly needs to be at a level that is useful for you, and takes away fear of movement, and gives you an understanding of what kind of parameters you're looking to work within. And in helping people to understand about pain, there's lots of ways you can go about it. So sometimes it's through discussion, sometimes it's through discussing people's experiences and what they've been through and what's happened today, and making some sense of something that's happened fairly recently, and tying in some pain science to that. Sometimes it's reading some great books now about pain science that are meant for the consumer, meant for the pain sufferer, like Explain Pain and Why Does It Still Hurt, and the Protectometer book. They're all really useful resources. Some people do better watching videos, so actually having a visual representation of what's going on works better for some people. So it's important that whatever the method of learning is best for you, that's catered for as well. What doesn't work so well is one person just rabbiting on about it, and a physio just beating the patient over the head with facts and knowledge. That doesn't work. So that's something that I think we've become better at over the years, understanding that the way we present it has got to be tailored to the way that the person learns, and the amount that they need to know isn't necessarily going to fill the textbook. There's a few basic principles that you need to know, and that's okay as long as it's a useful working amount of knowledge.